Do you qualify for LASIK? Are you a good candidate for LASIK? If you're interested in LASIK, this video is going to be very helpful because we're going over the top 5 LASIK qualifications, with the last one probably being the one that's not emphasized enough. Let's focus in. Hey, howdy everybody, this is Dr. Neil Guymon, Dr. Eye Guy, with the channel that keeps your eyes healthy and your vision clear. Now in this video, we're going over 5 broad category qualifications that could also apply to different refractive surgeries like PRK, SMILE, LASIK, so if you're interested in any of those, this video will still help. Qualification number 1, age. How old do you need to be and how old is too old for LASIK? Per FDA requirements, you do need to be 18 years old in the United States to get LASIK. A lot of doctors will recommend waiting until you're 24 years old. That's when most people will stabilize their prescription and their eyes will stabilize. But yeah, minimum age in the United States, 18 years old. Now on the other side, how old is too old? There really isn't an age restriction or an age that you're too old to get LASIK, but there are definitely a few things to consider. Now, usually when people start entering into their 40s, you start getting presbyopia. This is where people start needing reading glasses or bifocals in their glasses. And this will happen whether you have LASIK or not. So this is definitely something to be aware of, that you still may need reading glasses down the road, even if you've had LASIK. Also, in the later years of life, people might be having some other conditions of the eyes that might be causing blur, like cataracts. And so LASIK might not be the best option there because it might not give them the best results or the results that they want because the cataract might be in there blocking some of the vision. So really, as you get older, it becomes a case-by-case basis and conditions of your eyes, whether you might be a good candidate for LASIK. Qualification number 2 is with your prescription. How stable is it and how high is your nearsightedness, astigmatism, or farsightedness? Now your eye doctor will usually like to see that your prescription stays stable. It doesn't change for at least a year. 2 years is better. Now LASIK has the potential to correct for quite a bit. It can correct all the way up to a +6 farsightedness, -12 nearsightedness, or 6 diopters of astigmatism, which is quite a bit. Now that being said, this is a case-by-case basis. Definitely depends on the person. There are a lot of different factors and eye conditions that goes into figuring out how much LASIK could correct. So definitely take this with a grain of salt, but that's the potential of what LASIK could correct for. Usually it becomes a little bit more difficult to correct nearsightedness up past a -9 and maybe astigmatism past a -450. So that's when you start getting into the tricky territory, but it still has the potential. Now I do want to throw this one in here as a bonus or a side qualification. If you are pregnant or you're planning on getting pregnant, pregnancy's been known to change a prescription, so you might want to hold off on getting LASIK. Now LASIK is performed on the cornea of the eye. So qualification number 3, you want to make sure that you have the right thickness and shape to your cornea. They use the laser to reshape your cornea. The higher your prescription is, the thicker your cornea needs to be. If it's too thin, then they just won't have enough room or enough space or thickness to actually do LASIK on the cornea to correct all of your vision. Also in the same category, you want it to be the right shape. They'll do a corneal topography or a map of the cornea just to make sure that it's shaped right. If there's any suspicion of thinning areas or maybe LASIK might damage the integrity of the cornea, then you don't want to do LASIK because you could end up with a progressive thinning type of corneal disease like keratoconus or marginal pellucid degeneration, which is just bad. Qualification number 4, eye diseases. You definitely want to rule out any other eye diseases or eye conditions that you might have. Like I mentioned before, cataracts or macular degeneration. Glaucoma is a big one. Glaucoma can be a little bit trickier to manage after someone's had LASIK, or if some of these run in your family and you just want to be a little extra safe. And also indefinitely any other corneal conditions like keratoconus, like I mentioned before, or corneal dystrophies or genetic inherited conditions that might compromise the integrity of the cornea, where you just don't want to shoot a laser on there with LASIK. And I also would like to add diabetes into this category. You definitely want to have your blood sugar and your A1C under control because that could mess with and delay the healing from the surgery. Now just remember, these are broad qualification categories. Everybody's different. It's a case-by-case basis. Everybody's eyes are different. So make sure that you check in with your doctor to get a full evaluation to see if you're a good candidate for LASIK. But if you're learning something new from this video, definitely hit that like button for me. Number 5 is dryness, eye dryness. Now, this is the one that I think is probably not emphasized enough. Now, eye dryness is probably one of the most common complications or side effects after getting LASIK. When they do LASIK onto the cornea, it actually damages the corneal nerves. Those nerves are what sends the signal to the brain to regulate the tears. If the nerves are damaged, then your tear regulation or tear production might be out of whack. Now, luckily, most people have improvement in their dry eye symptoms, maybe taking up to 3 to 6 months. Some people might take a little bit longer, 6 to 12 months, but every once in a while you'll get reports of people reporting longer lasting dry eye conditions or symptoms or chronic dry eye conditions. So you might find more and more days eye doctors might screen more in depth for dry eye conditions or dry eye diseases. They might look at your meibomian oil glands, your tear production, just to see where you stand with your dryness or your dryness symptoms, because they know LASIK will push it and make it worse. They just don't want to push it over the edge and make it a really bad problem. And so eye dryness is definitely a big one to consider. Definitely not one that you should underestimate as far as being a good candidate for LASIK. Now that you know the broad qualifications, if you're a good candidate for LASIK, you definitely want to know the side effects, the possible side effects to getting LASIK. So definitely check out the next video in the series right there, or the full playlist to learn more. I'm Dr. Neil Guymon, Dr. Eye Guy. Stay focused.